Hey, what's going on? Last Viking TV here again. According to K5 News, coronavirus claims the lives of more than a dozen Life Care Center residents. The Kirkland, the city of Kirkland Life Care Center in King County has been on the news recently, and the state of Washington, Kirkland State, in the county of King, you may have been seeing them all over the news recently, have now just released an outbreak and updated news. Coronavirus claims the lives of more than a dozen Life Care residents, 13 Life Care Center residents in Kirkland have tested positive and died from the coronavirus COVID-19. As of Saturday, according to officials, Kirkland, Washington, the 2019 novel coronavirus COVID-19 outbreak at the Life Care Center of Kirkland has now claimed the lives of more than a dozen residents. There were 120 residents at the facility February 19th, and since that time, 26 of them have died. The outbreak was first declared a week ago on February 29th. 15 of those residents died in hospitals, and 13 of them tested positive for COVID-19, according to Tim Killian, a Life Care Center spokesman, on Saturday. An additional 11 residents died at the facility, and it's unknown if they died from COVID-19 or other causes. No information was available on their post-mortem test. Killian said, with Life Care being an acute care facility, it's not unusual to have residents die in the facility, and in a typical month. They may see anywhere from 3 to 7 deaths. There are currently 63 remaining residents at the facility who are being kept in isolation in their rooms, Killian said. If any of those residents show acute symptoms of the virus, they will be transferred to a hospital. Killian said the facility has received 45 coronavirus test kits, but they're in need of more and also need more staff. Great. I guess a lot of staff members were like, I ain't working here today. We've lost a lot of staff, said Killian, who explained several employees of Life Care are showing symptoms of COVID-19 and so are no longer working at the facility. The amount of stress that they are under is tremendous, said Killian. A task force of at least 30 medical professionals from the United States Public Health Service arrived at Life Care Saturday to help contain the outbreak. On Friday, King County Executive Dow Constantine said the task force would help support the already strained staff at the facility. Several residents of the facility were transferred to an area hospitals earlier in the week for the coronavirus treatment. The health and safety of all our residents, but particularly those residents of the Life Care Center of Kirkland, are our highest priorities, said Constantine. Let me go ahead and take a picture of this. Great. And Constantine stressed that everyone at Life Care will eventually be tested for coronavirus. Eventually. All residents and staff of Life Care are either being tested or they will be tested shortly, thanks to the state of Washington's increased testing capacity that's coming online. Constantine explained currently the Washington State Public Health Laboratory in Shoreline and UW Medicine are the only locations in the state that can test samples of COVID-19. Constantine said for the residents remaining at Life Care, if their conditions worsen, they will also be moved to a hospital. This is for many of the residents the best place that they can be. Those who are asymptomatic but have these health conditions that have to be attended to in a 24-hour care facility, explained Constantine. Some observers have wondered why the facility hasn't simply been shut down and evacuated. There's also no capacity at hospitals or nursing homes to take them all. Constantine addressed concerns raised by family members of Life Care residents on Thursday who demanded more resources to help the staff and remaining residents at the facility. For the families who say they are not being adequately communicated with, we hear you, said Constantine. We want to change that. We are 100% committed to the health and welfare of your loved ones. Constantine also said if family members who want to pull all their loved ones out of... Okay, so Constantine also said if family members want to pull their loved ones out of the care and bring them home, the state will help provide them support. Many family members expressed that desire on Thursday, but said they cannot because they don't have the equipment or capacity to care for loved ones at one's home. We are working with the state to set up a system with an expert to help them that will provide the support they need to be able to do that, said Constantine. Currently, the Centers for Disease Control and Prevention, the Washington State Department of Health, King County Public Health, King County Emergency Management, City of Kirkland officials, and the Life Care Center staff are all working to give the remaining residents at the facility the care they need. So this is breaking news. As I said, I would update many more videos to come on this coronavirus as I get updates. They will all be posted on this YouTube channel, and I will basically be putting it here. You've heard it here first, second, or third, and so thanks for listening and watching. Please make sure you hit that subscribe button down below, and please make sure you share this with all your friends and family. A lot of people are still in the dark about, are people really dying from this? It's a silly question, I know, but a lot of people are still concerned if people are not even really aware that people are dying from this virus. Even though it is the elderly, and even though that some children are also getting it, the middle-aged and young healthy individuals are going to be at risk also if this second stage of coronavirus starts to come into the United States. Currently, the United States is currently dealing and working with only the first stage of the coronavirus. There is now a second stage coronavirus currently morphing and developing in China. Once that virus comes to the United States, there is no cure for it. The symptoms of that are far greater than the one that we have here. The coronavirus has 2 stages, and there is a second stage already being born as we speak, but it is not currently found in the United States as of yet. Currently, we are just passing around the first stage. Second stage is to come. So how do you prepare for it? You just wash your hands, stay away from people that are coughing, sneezing, stay away from nursing facilities. If you feel like you've been in an area that you just don't really want to be, and then you need to go to a nursing facility, stay away from the nursing facility because the elderly are the most vulnerable. If you need to go into a nursing facility, wear a mask. If you've been out in public, wear a mask before you go into the nursing facility. These are for also people that work at nursing facilities. If you're a caregiver and you work at a nursing facility, wear a mask all the time, because the elderly that you're working around, you're putting their lives at jeopardy. So please make sure that you're considerate of other people around you, making sure that people around you aren't sharing it and that you're not sharing it as well. Because again, you could be asymptomatic and not show any signs and not even know it until it's already too late. So please make sure you hit that subscribe button down below this video. Subscribe. I'm getting to almost around 2,000 subscribers and growing every day. Please make sure you watch my videos all the way through, as that also helps the viewer count and gets my video out to more people, and more people are able to see this as well. So please make sure you share this and subscribe. Thanks so much. Until next time, Last Viking TV is out.